All right, good morning. I'm Andrea Hammes Dodge with the Ames Chamber of Commerce. Today we're meeting with our friends at Mary Greeley Medical Center with COVID-19 happening in our community right now. We have a lot of questions, and so we went right straight to the source to learn more about COVID-19 in our community and what we can be doing to help protect those around us. So with me is we have Amber Deardorff. She's Vice President of Clinical and Support Services at Mary Greeley. Good morning, Amber.
Good morning.
And we also have Leann Hillier, and she is our infection preventive, yes, at Mary Greeley Medical Center. Hi.
Hello. Thanks for having me.
So this message is out for our members, chamber members, as well as anybody in the community who wants to know a little bit more information about what's going on with COVID-19 in our community. So one of the questions our members asked about is, how will we know as a community when COVID-19, when there's a positive test in our community? How will we find that out?
Sure, Leann, I can start and then you can certainly jump in. Right now, most of our testing is still being done through the state hygienic lab. And so the Iowa Department of Public Health has some set criteria for patients. And if the patients do meet these set of criteria, it goes through our state hygienic lab. And then all of that monitoring is being done by the Iowa Department of Public Health. And they're the ones that are tracking each case within the state. And so typically we would see that announcement being made through the state level at this point. We do know, though, as our testing resources are limited at the state and honestly as a nation, we are utilizing some outside what we call reference labs. So other labs around the country can help us do some of this testing. And that's where some of the results coming back may be a little delayed getting to the state. Or maybe even just get missed altogether. But those are the two different ways that we are currently testing within the state. Leann, what would you like to add to that?
The only thing, everything you said is exactly on target. The only thing I would add is just to let people know that we do have adequate testing supplies. So they shouldn't, not come in, or say, hey, I can't even be tested, so I'm not going to worry about it. Don't let that stop you.
Well, that leads into my next question, actually. So at what point do we come into the doctor? Like, I know we've been hearing on the news, maybe don't go in, maybe call ahead first. What are your recommendations right now for the community?
Yes, exactly what you just said. Definitely, if you think you've been exposed or you traveled or you're just worried about it, yes, call your doctor. Definitely. So the symptoms we are looking for, which I know have been in the media a lot, certainly a fever, if you've got a cough, if you've got difficulty breathing, and then, like we said, call your doctor first. Calling ahead is really just going to help protect everybody. So then we'll know when you're coming in. We've set up some phone triages, and we can do a lot of that assessment through the phone first. Amber, do you have anything else you want to add to that?
Yeah, Leann said it probably 2 or 3 times already, but it's critically important that patients are calling their healthcare provider first, because those staff that are answering those phones can ask a set of questions to help determine, is it appropriate for them to come in or do they want to stay at home right now? Certainly, if you're experiencing any emergency type situations or symptoms, don't wait, come into our emergency room. You can certainly call our emergency department first, just as a heads up, hey, you're coming. But for the hospital side of things and the emergency department, we are certainly here to help care for those with the most critical symptoms. Otherwise, call your primary care provider first.
Wonderful. Now, another question we had come up from one of our members is, how long does this virus stay active on surfaces, and what kinds of surfaces? And I guess, how do we protect ourselves?
Yeah, that's a great question. And that's something we're continuing to learn more and more about as time goes on. There was a recent article that came out in the New England Journal of Medicine that gave us some real specific times. It said 24 hours on cardboard, 2 to 3 days on plastic and stainless steel. So those are, some sort of guidelines, but the real key takeaway, I think, is that we really need to clean high touch surfaces frequently, and to clean them with a disinfectant, and continue to do really excellent hand hygiene. Those are the big things to take away from that and learn. Amber,
are there specific sanitizers that we should use, or that maybe should not use, that aren't as useful as we think they are?
Yeah, yeah. So the important thing to do actually is a disinfectant is what you want. So a lot of the disinfectant wipes will work just fine. Things are not, since this is a new virus, things are not labeled to say COVID-19, that it kills that. Mm-hmm. They are labeled, they'll say coronavirus. And the guidelines that we've received from the CDC and the EPA are that if it says coronavirus, it is effective against that. So look at the label. Most disinfectants work just fine for it. A very dilute bleach would work fine. And remember, whenever you're doing cleaning, to really use that elbow grease and follow the directions on the bottom. Those are the big things with cleaning.
Great. Now, some of the questions we have received also from our community are wanting to know how's the hospital prepared? How are the staff? How are equipment, rooms, capabilities to once this becomes, we know it's here somewhere. We don't have positive tests yet, but once it's here and we have people really needing care, how well prepared are you guys? And tell us a little bit about your responses.
Sure. This has been going on, and the planning has been going on for months now. So when we first identified this over in China, we activated our emergency response team and got a group together and said, hopefully this will just be a good drill, and we can make sure that we're prepared if or when this, at that time, coronavirus would come over to the United States. But I would say the last 2.5 weeks, it has been a tremendous amount of planning and prepping and fantastic teamwork going on here at the medical center and within the medical community as well. Obviously, McFarland Clinic is a very, very close partner with us, and we are working in conjunction with them. Things that we are doing, obviously, the surge planning that we have, bed management is a big part of that as well. And just the daily operations. How do we, like you said, how do we make sure that we have adequate staffing available? Right now, just to give you an idea, we have an average admission of about 191 patients as an inpatient through our facility each week. That will significantly increase if or when COVID-19 does hit our community. And so we had to think a little bit differently with our staffing plans. So things that we have just recently done, for example, this week is, any of our outpatient services, outpatient clinics, some of the outpatient surgeries that we're doing as an elective surgery, we are postponing a lot of those things so we can pull in those staff and that resource to make sure that they are fully trained and ready to take care of the patients that walk through our door. We do know approximately 20% of those that are infected with COVID-19 will need some type of hospitalization. And kind of depending on what countries you look at, it's anywhere from 5 to 10% of those that come into the hospital will need some intensive care as well. And so we have a variety of different surge plans. It's really what we're calling them. And so we have our surge plan for our intensive care beds. If or when we exceed the capacity of our current intensive care, how do we make sure we have enough ventilators on site? How do we make sure we have enough physicians and staff to care for those patients? Where else can we care for extra intensive care patients within our walls? We have another plan like that for our medical beds. And so if they don't require ICCU, but are sick enough to be here hospitalized, how can we utilize other areas of the hospital to care for those patients? And then finally, there's this last group of the recovering patient. So, they're maybe not quite well enough to go home, or for example, we don't want to send that patient back into a community to infect others in that area. Where in our hospital or where in the community can we send these individuals and take excellent care of them as well, but allow them to recover until they're safe enough to go home? Leann, what did I miss?
The other thing I think we're really, really hitting hard on is to keep our staff and our employees safe. And that, we're working really hard on education, like Amber mentioned, and PPE use, the proper personal protective gear, making sure that they have it, that they use it right. Otherwise, I think you hit everything.
Yeah.
Well, wonderful. That's all the questions we had pre-prepared. So if there's anything else you'd like to share at this time, please go ahead and do that, and we'll follow up with any links on our website. So is there any final words you'd like to share?
I always like to tell everybody to social distancing is key, and hand hygiene is the other thing. Cover your cough. Make sure you're doing that. You know, our basic hygiene, and stay calm. Yep, help each other out.
That's right. And the planning is happening within this community. Dr. Fulton, who is an infectious disease physician here in the community, left us with some inspiring words a few weeks ago. They are, don't panic, be positive, and kindness counts. And truly, that's what we all need to remember during this time. It's new for all of us. We're learning as we get new situations through our door, but this is our calling as healthcare providers, and we will be there to take care of our community when the time comes.
Thank you so much, both of you. Those are, you know, this is a really great information we're able to put out for our members. We want to thank you and all the healthcare professionals in our community who are working so hard and diligently to help keep everyone safe. You know, Amber, when you and I talked last week, you had made the comment that it is, you know, it's our duty to protect those most vulnerable. And so, you know, that's why I'm at home right now. That's why the chamber staff is all working from home, except for a few core people at the office, and we're trying to do our best. I know that likely I'll probably get it, but I won't. I'm younger and healthier, so it probably won't impact me as hard as it could my neighbor who is has been going through treatments for breast cancer. So we're just trying to do, everybody's doing our part. So we thank you all for being on the front lines, sharing the information. So any links you'd like to have, we'll go ahead and put that on our website at ameschamber.com. We have a resource page that we're constantly updating, and we'll continue to do some videos like this throughout the coming weeks, just to help keep everybody informed with our latest updates. So again, thank you everybody for watching, and thank you Leann and Amber again. And I hope you guys have a great day and a safe and healthy week.
Thank you,
Thanks very much. Bye-bye.
Bye-bye.